There are a number of things we've learned from research that can increase our risk of getting cancer. Some of the things we can't change. We can't change getting older, and we can't change our family history. However, only about 10% of cancers are due to family history. It is important to know what runs in your family and discuss that with your nurse or doctor, but you can do way more by how you live your life. Smoking tobacco, if you could quit, is the #1 thing to reduce your risk of cancer. Smoking causes some cancers directly, such as lung, but it's implicated, that is, it's involved in the starting and feeding of many cancers, including colorectal, breast, cervical, mouth cancers, all of that. There are many benefits to quitting smoking, and those would be things like our food tastes better. After a short time, our energy and our ability to run up a hill is increased. They decrease your risk of heart disease, diabetes, strokes. If you live with a smoker, you get exposed to what's known as secondhand smoke, and that has some of the risks associated as if you were the smoker yourself. What we eat has a great deal to do with our general health. The kind of nutrients we put into our bodies do give it the fuel to build and repair cells, and it's the problems with repairing cells that can lead to cancer. So eating really well matters. Eating things like country food as much as you can. If you're having any breads and grains, to have whole grains, and fruits and vegetables as much as is possible. Fresh ones are often hard to come by, but frozen or canned, especially ones that don't have added sugar and salt, are just as good for us. Keeping a good fit weight is a really important thing for all of us, for many diseases, but particularly for cancers. Being fit is really important for cancer prevention. Do traditional dance, go berry picking, split wood, join a sports team, get out on the land in some way or other. Trying to get at least 30 minutes a day of pretty strong physical activity is the minimum. You can do that in 10-minute chunks, like for instance walking to and from work. There are 2 vaccine programs in the NWT that help prevent cancers. There's the HPV vaccine that helps prevent cervical cancer. It's available free of charge to all young people, boys and girls, from 9 to 26 years of age. The public health nurse or community health nurse will administer it and will know the details of this program. The hepatitis vaccines are also available to help prevent liver cancer. Speak to your nurse or doctor about which is right for you. If women breastfeed their babies, that is a really good way to give the baby all the nutrition it needs for the first 6 to 24 months of life, but it also helps the mother's health. It can reduce her risk of getting breast and ovarian cancer. Alcohol can affect a number of systems in our body, and it is particularly likely to be one of the factors in making it easier for cancers to develop. So alcohol is generally a poison to our systems, and it also decreases our immunity, which again increases the chance of cancer, but a number of other diseases as well. So our motto is, if you don't drink, don't start. But if you do enjoy a drink or two, then as a man, your maximum recommended amount in any one day is 2 drinks. That would include beer, wine, or hard alcohol. If you're a woman, we suggest a maximum of 1 drink in any one day. Women who are pregnant should not drink at all. It's good for all of us to go for our regular screening, especially for those 3 programs that we have easily available to us in the Northwest Territories. If we catch a cancer in the very early stages, before you even know you have it, the chances of treating it and curing it are much greater than if it's left. We can feel fit and healthy and still have some early cancer cells changing in our bodies. If you have a family history of cancer, it's important to share that information with your nurse or doctor. they may recommend that you come sooner or more frequently for the screening for that type of cancer.